Hi, it's Dr. Joanne. I'm going to take you through an introduction to craniosacral. This is an osteopathic technique, and it's pretty much light touch. It works on the level of the nervous system, the fascia, and the connective tissue. It's gentle and pretty appropriate for most people, and I'm going to show you the listening stations, which are the first places we check in on the body in a craniosacral session. All right. So in general, with craniosacral therapy, the patient is fully clothed and lying on the table. Our first listening station is actually going to be on the tops of the feet, and you can assess the craniosacral rhythm here. So I'm going to go ahead and do that. And the craniosacral rhythm is similar to a pulse or a respiratory rate. It has a recognizable frequency, it has a recognizable pattern. Just like the heart, the bump of a heart, or the breathing rate, it has a pattern that is repeated, and any deviations from that pattern gives you an idea of where there might be some sort of restriction or some sort of dysfunction. So the first thing I'm doing here is I'm comparing her left side to her right side, and I'm assessing the excursion and the pattern of that craniosacral rhythm. And I notice there's more restriction on the left than the right. So this is just the what. It doesn't tell us the why. All right, so then I'm going to check at the bottom of the heels. And just tuning into that craniosacral rhythm again. And here I can also assess any restrictions in the fascia. So the fascia is connective tissue that goes from basically the top of the body to the bottom of the body, all the way through, and it's all the way between, around all of our organs, all of our tissues, all of our muscles. Everything is surrounded in fascia. So even if you have a restriction or an issue at your ankle, that can make a difference to what's going on in your shoulder. That's how connected the body is. And so that's how I can assess the whole body just down here at the feet. So again, I feel more of a fascial restriction on the left. Ankle. A little bit at the knee. Yeah, left side feels tighter to me. We will see. All right, so the next listening station is going to be the anterior thigh. So I'm just going to place my hands here, and again, we're just assessing for that pattern. And the rhythm goes into a flexion and extension, just like any joint in the body would. The different positions on the body, that flexion and extension will be a different movement. In the femurs, it's a rotation in and a rotation out is our flexion extension. And so we're assessing that pattern. Yep. Okay, so I'm going to do the same thing on the front of the hips. Change sides of the table so you can see better. And now I'm going to go to the anterior ribs. So we're looking at thoracic diaphragm. So we look at the pelvic diaphragm, the thoracic diaphragm, and then up in the throat, closer to the top of the ribs. There we go. So the next hand placement would be just on the front anterior chest. And we're just getting an assessment. These are, again, the listening stations. We're going to do the top of the shoulders. And you can check into the arms. arms as well. Nice. And then there's 3 cranial holds, or 3 holds of the head that you can do, which are part of the listening stations, and then the front of the throat. Is it okay to touch the front of your throat? Okay, so the front of the throat is just placing your hand very, very gently on either side of the hyoid. And then one hand on the back of the neck. Sorry, my hands are freezing. There we go. All right, and then the cranial holds, I'm going to put my hand underneath your head and let your head rest down. So I'm moving a little more swiftly than I would normally in a treatment, but just to show you the positions. And then the last one, can you lift your head for me? And the last one is front to back like this. Good, there you go. And from here, I would look at any of the areas that I noticed any sort of fascial restriction or any changes in the craniosacral rhythm. Those are sort of indications of where we need to go a little more deeply, look a little more closely. This, in general, is very comfortable. Would you agree? It's very gentle. It's nice for people who've had a history of trauma or pain or anything like that, because it's non-invasive, very light touch. We use only grams of pressure with our fingertips to do our assessment, but also to do the treatment. So a lot of these techniques, even though we're using them as a listening station approach right now to kind of get an assessment of what's going on, they can also be converted into a treatment using the same approach. All right.